Hi, we are Group 12, and our group members are Christopher, Teresa, Jackie, Lynn, and Joe. For our Change the Law project, we are proposing to require a drug image on the dispense label for solid dosage forms. Currently, Washington State does not mandate any type of physical description on the prescription label. Medication errors have the largest impact on our healthcare system, costing the U.S. over $20 billion a year. Confusion regarding prescriptions and mismanagement of drug therapy increases health risk for patients. We believe that including an image of the drug with the shape, color, and imprint on the prescription label would reduce medication errors that stem from patients' inability to identify medications and appropriately administer them as instructed. This will improve patient adherence to their medication and also act as a safety net for both patients and pharmacists. The most common medication errors are dispensing the wrong dose, confusing look-alike and sound-alike medications, and drug-drug interactions. Patients that are at risk for medication errors are those with multiple medications, the elderly, those with low health literacy, and those with limited access to health care. According to the Campaign of Patient Safety, they reported to the California Board of Pharmacy that between June 1997 and March of 2000, that misplacing the wrong pill into the wrong bottle contributed to most of the dispensing errors. In another study done by the Journal of American Medical Association, they conducted an analysis on a large hospital pharmacy in Springfield, New Jersey, where there were 1,371 mistakes found among 9,800 filled prescriptions, ranging from the wrong pills being misplaced into the wrong bottles, wrong dosage, and even labeling errors. For our proposed law, we want to amend the current law, RCW 18.64.246. In addition to all of the items required on a prescription label, we wanted to have it include a color image, which will include the color, shape, and imprint of the dispensed medication.
Misidentifying a medication is a major source of medication error, whether the wrong medication was put in a patient's bottle or the medication is confused at home. We will want to measure how the proposed change has impacted medication errors by measuring error rates in the community before and after changes have taken place. We can also survey patients and pharmacy personnel to rate usefulness of the colored image on the label. The changes in rates of error will be long-term because patients will become accustomed to having an image to check their medications against and will tend to be more alert to changes. Increased cost will be related to adding color to the image, which will for many pharmacies mean new printers. Most systems are able to customize labels with text, which would keep costs to a minimum. Oregon State Board of Pharmacy estimated cost of $12.50 to $300 per pharmacy if they are able to use existing software. Cost can be offset to individual pharmacies by decrease in liability and issues resulting from errors. From a larger perspective, decrease in errors increases positive health outcomes for patients and avoids unnecessary hospitalizations, which decreases cost to the healthcare system as a whole. Policy which requires text description of solid dosage forms has already been successfully implemented in Oregon and California. In Washington State, we also have the technology to provide text descriptions with minimal adjustments from a minority of pharmacies. Technology to include a color image may be more challenging at this time. Administrative backing is expected from PQAC and medication safety organizations such as Institute for Safe Medication Practices.
So for alternative existing law, there are several different alternatives to our proposed law. The first alternative is going to include the textual description of the color of the medication and the black and white image of the medication on prescription label. This would provide the patient with visual aid that can enhance communication between patient and healthcare provider when describing the medication in a layman terms and can use accurately identify misplaced medication. Most importantly, patients will feel reassured that they are taking the appropriate medication based on the appearance of the drug and its description picture on the label. Because the disadvantage of the black and white image is that it makes more difficult for the pharmacist to easily and quickly distinguish look-alike medication. So to prevent this oversight, a tactile description of the color of the medication will be incorporated together with black and white image on the label to help the pharmacist easily verify the medication on the bottle. However, one downside of this first alternative is that amount of space that may be needed to incorporate both black and white image and a textual description of the color of the medication. So the second alternative is putting only a clear typewritten textual description on the dispense label, which including the color, shape, and imprinting. Since the description would take up less space on the label and will only require black ink, this would minimize the chance of needing new software or printer, so therefore reducing costs. However, one of the disadvantages of this alternative is that many patients would not pay attention to more text on the prescription label, and the drug prescription would likely to be overlooked. Also, this option will not include patients with low English literacy. The third alternative to color image on prescription label would be providing a leaflet which including a black and white image and a tactile description of the color of the drug, in addition to the packet insert that the patient is receiving. A positive aspect of having description on the leaflet instead of the color image on the label is that there would be not as much as size restriction and the marking would be clearer. The size could be as large as needed for the patient who might have the visual problem. However, the disadvantage of this alternative is that the leaflet can be easily misplaced because it's not physically attached to the prescription vial. Since this will be needed to be reprint every time the patient pick up his or her medication, including the refill, it might end up being even more costly and wasteful, especially since the patient often discard their leaflets soon after receiving their medication at the pharmacy.
Stakeholders. Those affected by the implementation of color, shape, and imprint and image on the prescription labels include independent pharmacies, organ pharmacy, software developers, and patients. Independent pharmacies. Independent pharmacists believe that color, shape, and imprint has been helpful ever since they have implemented in their pharmacies. They believe that color image can be more helpful for the patient to recognize their medications. However, their software is dependent on the distributors of the drugs, since each of the pharmacies use distributor-supplied software. Organ pharmacy. An organ pharmacist mentions that since they already have implemented color, shape, and imprint, they believe that it has been very helpful. However, the pharmacist also mentions that an image addition could be very difficult since space is already limited and technology is not very cost effective. Software developers. Software developers say that software already has the capability to add images, and new software does not need to be written. Hence, implementation of a new software or just an image would not affect the developers. Patients. A survey of patients revealed that patients like the idea of colored image, and because such changes will help them be confident about the medication that they're taking.
Adverse drug events from medication errors have been increasing exponentially, mainly due to taking multiple medications. We recognize that implementing this labeling requirement can provide the patient with an easy way to accurately identify the medications, enhance communications between patient and pharmacist, and most importantly, prevent some of adverse events from medication errors. However, there will certainly be costs associated with adding or modifying new technologies to our current pharmacy practices. Furthermore, some of stakeholders believe that it will take time to implement the changes due to lack of demands. Even with financial impediment, we firmly believe that the long-term benefits from labeling requirements such as increasing patient safety and improving patient outcome with medication use will outweigh the total healthcare costs from medication errors. We strongly urge our stakeholders and the Commission to be the proponent in adopting our proposal, the labeling requirement for Washington State. Thank you.